May we move then to item 10 on the agenda, which is the conflicts of interest paper. Ian, over to you.
Thank you. I'll be brief. At its last meeting, the board approved for consultation strengthened arrangements for how CCGs manage conflicts of interest. The core elements, as set out in paragraph 4 of the paper, have been broadly welcomed by those responding. In response to the feedback we've received, we propose to make a number of specific adjustments as set out in paragraph 7, and so subject to board agreement and delegation of the approval of the final version of the statutory guidance to myself and to Paul, the new requirements will commence in June.
Thank you very much. Bruce.
Thank you. Ian, only 38 CCGs are responded. Is that because the remaining CCGs are completely happy with the guidance, or it seems to me that since this applies to them, that's quite a small sample size?
I would say the reason why we only had 38 respondents is because of the depth of the engagement that occurred with CCGs prior to the consultation.
Okay. Yeah.
Can I just say, I think this is a very good piece of work. I think we should commend the way in which the policy has developed, the positive, largely almost all positive responses we've had from CCGs, and it forms a very important basis for the broader pan-healthcare group that I am chairing on conflicts of interest across the piece. So we will no doubt pick up learning from this exercise, which can be transmitted into the broader view. Are there any further issues for Ian? No? In that case, Ian, thank you very much. I'd like to turn now please to item 11, which is the Diabetes Prevention Programme.
Yes, so I just wanted to share our progress on this sort of important agenda item for NHS England during the past year. Obviously, this was an important programme for the 5-year forward view as part of the prevention programme, and demonstrates a good partnership between ourselves and Public Health England and Diabetes UK in working on how we can try to tackle prevention of diabetes more systematically. So we've been through a procurement process to procure some providers to provide services nationally for patients, and those have been procured and are in the phase of mobilising as we speak now. And in parallel, we've been looking to identify people who are appropriate to be referred to those programmes, and 7,000 people are in the process of being referred by the end of March, but we hope that by July we will be up to 10,000 people, and that's when the services will be largely mobilised for our initial pilot areas, our initial set of 10 areas who've awarded local contracts. That will then extend through to a further 17 in June, and overall we hope to achieve 40,000 people being referred during 2016-17, and by 2019-20 we should be getting up to 190,000 per annum for the programme, with all of the various initiatives that are going on. So it was to assure you that we're making real progress and starting to deliver some real change to people on the ground. It's worth reminding people that this is it's a pilot mode. We've only procured these services for a relatively short period of time so that we can evaluate them before we go for a more substantially longer term and embedded national service across the country. So we'll be doing a lot of evaluation about the approach for this programme as we go forward. So I'm very happy to take questions as we proceed.
Michelle.
Thanks, Karen. What opportunities do you think are there for new digital service interventions and the potential partnerships with voluntary sector in scaling up at reduced cost and reaching more people?
Yeah, no, it's a really good question. Thank you. there's clearly a huge opportunity, and we're exploring that very proactively. And we were built into the contracts in any case that we wanted our existing providers to pay attention to innovation and digital usage as well as face-to-face, but these are largely face-to-face at this stage. We're working very closely with Diabetes UK, of course, who have a very strong digital presence in their risk assessment tool, which they offer, and we're looking to see with them if there are opportunities for us to use that and expand that reach into a wider group of people. And in parallel with that, we are working through the programme on what might be a digital offer that we will be able to procure and expand nationally. And that could well be a way of very significantly increasing scale across the country very rapidly by getting to people more directly and more quickly. Obviously, we will need to test as we do that how effective that is, but if we can get the scale, I think that is still hugely valuable and definitely something we want to progress. So
And
yes, really
what sort of
important for us.
timelines are you looking at for concluding your thinking and testing in the digital space?
Yeah, so we've already had an information day with suppliers during May, specifically in order to get as much visibility of this with suppliers, so we could start the conversation as we are now with suppliers about what the sorts of things are that we could be doing. So that's already happened, and we got a much larger number than we expected, which was fantastic. Large and small scale, and different sectors, as well as digital specialists. We're hoping that during the course of this calendar year, we will have been able to specify a procurement and started to launch a procurement, but we're trying to still navigate exactly what the best route is for doing that, so that we don't over-specify, but that we work with suppliers who are able to help us think about what the best possible approach will be, and we'll be doing that with Diabetes UK as well because of their expertise in this.
Thank you.
Good. Well, thank you very much, Karen. I ask the board simply to receive the update.